Okay, so in regards to this assignment, I think the hardest part for me was the last two bullet points because those are the topics that I have the toughest time with. Um, First two bullet points weren't that bad. Having said that, I'm going to attempt to tackle this. Again, sex and biological differences is pretty easy for me to grasp. Gender based differences, on the other hand, are a little bit more difficult for me to tackle. But having said that, this presentation is for respiratory therapists. So part of the presentation will involve discussing the difference between sex and gender. Sex is defined as either of the two main categories, male and female, into which humans and most other living things are divided on the basis of reproductive function. So, gender, on the other hand, is defined as either of the two sexes, male and female, especially when considered in reference to social and cultural differences rather than biological ones. So, the terms also used more broadly to denote a range of identities that do not correspond to established ideas of male and female. I'll attempt to go on a journey exploring the concepts of patient based care versus gender based, using a scenario and some data from scientific journals. In the end, I'll offer my ultimate thoughts on the matter. So, for respiratory therapists, there are two equations that have been developed in order to avoid serious injury to either a male or a female patient. This is due to anatomical differences between the sexes. So, the equations are 105 plus height, you know, times height in inches minus 60, and there's also 106 plus 6 times height in inches minus 60, and these formulas can't be used interchangeably. Doing so would risk safety to the patient, and these equations are used to find an appropriate initial tidal volume for a given patient. It's done for patient safety and best possible outcomes. So, tidal volume is basically just a fancy way to describe breath size. So I pose the scenario. In this case, we have a female to male, or FTM, transgender that presents to the ED with respiratory failure, noted cyanosis, and a GCS of 6. So the decision is made by the attending provider to intubate. Rapid sequence intubation, or RSI, is imminent. So which of the two formulas are you going to choose? What gear will you offer the provider? Will you perform the procedure based on sex or gender? And how will you defend the decision if it ever goes to court? So, this scenario should provide food for thought. The outcome for the hypothetical patient grows increasingly negative with every moment of indecision. On the medical stage, one must treat the patient appropriately and safely. In this case, the patient must be treated as a female, in my opinion, or the professional risks causing serious harm. So, let's go on this journey. Let's suppose that the medical staff decides to treat this female as a male in this setting. So the provider uses an endotracheal tube that's too large for the patient, that can potentially cause trauma to vocal cords and cause tracheostenosis or tracheomalacia. So that's either like hardening or softening of the trachea internally. Overinflation of the lung can cause it to rupture, which would cause a pneumothorax. So now you have to take an extra step. Now needle decompression must be performed, and in the meantime, our respiratory failure suffering cyanotic and comatose patient's outcome has worsened. So the ability to oxygenate has been severely compromised, leading to a possibly coding patient. Suppose the patient does code. Now the breaking of the sternum and possibly ribs is highly likely from compressions. It is also possible to cause flash pulmonary edema, which would manifest as blood flooding the ET tube and misting the compressors through the ambu bag's PEEP valve with every compression. It's pretty gruesome. I've seen it happen. But let's move on to the topic of gender-based care. Searching several sources revealed that females are marginalized when it comes to gender-based care. Planned Parenthood is touted as a provider of care for this marginalized group. And I quote, Planned Parenthood began 90 years ago as women-centered healthcare organization, Weintraub says, with a focus on providing medical care in a setting where women would feel comfortable. However, male patients make up less than 10% of that clientele. According to Stuart Amade, who writes for the Journal of Neuroscience Nursing, we're all aware that certain diseases are more prevalent in one sex than another, but the reasons for the differences are not clear. For example, meningiomas are far more common in women, as is subarachnoid hemorrhage. Risk factors for diseases also vary between the sexes, and women tend to have poorer outcomes. So it's known that the number one killer in women is heart disease, and postmenopausal women have a greater mortality for vascular disease than men. Females are also subject to the majority of gender-based violence. She concludes that given these disparities, it is surprising that little attention has been paid to the issue of gender-based care. Moving on, according to Lagos, estimates from logistic regression models using cisgender men as a reference group. Cisgender men are basically men that are born male and identify as male. Show that gender nonconforming respondents have significantly higher odds of reporting poor self-rated health than any other gender identity group. So I understand that the assignment calls for the promotion of gender-based care, but I completely disagree with such a notion. Patient care should not be gender-driven, it should be sex-driven. All of the arguments entertained point to the root of the problem being sex-driven, not gender-driven. In fact, it seems that the more gender-based the approach, the more the other gender is left out. So take Planned Parenthood, for example. 10% of the clientele is male, which means that 90% is female. So for all of the advocacy that one can find regarding female marginalization or the gender nonconforming feeling lesser than their heteronormative male counterparts, where are the advocacy groups for men? So, men are routinely marginalized. Where's the outcry, for example, against male genital mutilation? If anything, it's seen as something normal that's done day to day. Ultimately, what I take from this journey is that gender-based care tends to attract the gender that the care is aimed for, but it alienates the other. If hard-pressed about a new approach to gender-based care, I would advocate for the dismissal of it altogether, because ultimately healthcare should be patient-based, not gender-based.